It's very, very hard to kill a healthy child with any infectious disease, but particularly with measles.
A school-aged child has died from measles this week, the first measles death in the United States in a decade. Kennedy routinely downplays the risks of infectious disease to children to build up his story that vaccines are not necessary. Look at this example from just this week in a press conference about the current outbreak of measles centered in West Texas, where Kennedy lies about patients hospitalized with the measles virus.
We were watching it, and there are about 20 people hospitalized, mainly for quarantine.
Nope, the chief medical officer of the local hospital says that's simply not true.
We don't hospitalize patients for quarantine purposes.
Measles can have severe health consequences, including pneumonia, encephalitis, brain damage, loss of vision, destruction of prior immunity to other pathogens, and death. And the patients in the hospital are receiving things like supplemental oxygen and respiratory support for that severe disease. Among the 124 cases reported so far, only 5 had received measles vaccines, which means there's 24 times as many unvaccinated cases. That's because getting 2 doses of the measles vaccine reduces your risk of measles by around 97%, which is why measles outbreaks typically begin in these small, close-knit communities that have low vaccination rates. Kennedy has an impressive history of lying about measles and the measles vaccine.
And the World Health Organization now says vitamin A is an absolute cure for measles, which we didn't know about back then. Back then, we were treated with chicken soup, and it was, a week at home.
Misleading as usual. You notice he failed to mention that the same World Health Organization says that community-wide vaccination is the most effective way to prevent measles. All children should be vaccinated against measles. Of course, it is also true that there is some evidence that vitamin A may help reduce risk for severe complications from measles, but it's certainly not a replacement for vaccination, even according to the WHO, and he took that out of context to support this story that vaccines are not needed. The anti-vax organization that Kennedy led prior to his campaign, called Children's Health Defense, has been working overtime to tweet misinformation about the current measles outbreak. They've claimed that this is a vaccine-induced outbreak of the strain of measles in the MMR vaccine. Kennedy's former organization's team of quack scientists may not know this, but public health researchers routinely sequence patient samples of the virus during outbreaks like this. They do that to help trace its spread, and in this case, every sequence has been of the D8 genotype. The MMR vaccine contains the A genotype, which clearly shows this is a wild measles outbreak, not a vaccine-induced outbreak. I could debunk these guys in my sleep, but their claims are good at stoking emotion and fear, and therefore getting a lot of social attention. I'm a scientist, and I try to hold this type of dangerous health misinformation accountable. My wife is board certified in pediatrics, and we have a young daughter who has received all of the recommended vaccines, including MMR.